The Primary Maternity Care suite of programmes are the first and, to our knowledge, the only suite of programmes designed specifically to meet the Lancet Series framework for quality maternal and newborn care. With that in mind, these programmes have been created by a team of experts to enable you to meet your personal career goals and to enable you to be part of moving quality maternal and newborn care into practice. We've consulted widely with an international team of experts to ensure that our programmes absolutely meet the needs of future employers and enable you to meet your personal career goals. So let me tell you a little bit more about our programme structure. We recognise how difficult it can be for busy practitioners to combine study with work and with home life too. That's why we've made our programmes really flexible. So when you choose to study with us, you can choose to do one course per trimester or up to 4, and you can change that every trimester. The important thing is that choice and flexibility are key factors within this programme. Okay, so I'm sure you want to know more about our programme. There are 2 pathways you can choose. You can either do a standard pathway, or if you're interested in research, you can do a dissertation pathway. What's common to both pathways is you will undertake a total of 12 courses, and the first 5 courses are common regardless of which pathway you choose. There's also a great deal of choice and flexibility even within those 5 core courses, depending on what your career goals are and depending on which professional background you come from. So, for example, if we look at the first 3 courses that most students choose to undertake, you will see one of them is called Primary Maternity Care in Context. This sets the foundation of what this programme's about and links beautifully to that Lancet Series framework that we've already talked about. You will also undertake a common course in global maternal health, and you will look at a course called Changing Childbirth that's the how-to behind all this. How do we actually make this happen? Depending on your professional background, the next 2 foundational courses you do will absolutely depend on what you want to do with your career. So if you're a midwife and you want to really home in your clinical expertise, you would choose Critical Skills for Midwives and maybe the prescribing course. If you're not a midwife, or you're a midwife no longer in clinical practice, you might want to learn more about transforming healthcare, or do counselling skills, or even look at diverse communities. Regardless, remember, flexibility and choice are the key features of this programme. Once you've completed the first 5 foundational courses within this programme, that's when you can choose whether or not you want to do a standard pathway or a dissertation pathway. Everybody needs to know about applying research into their practice. So everybody will do a foundational research course, but then you need to choose whether you want to focus on undertaking a piece of research in your programme, in which case you would do research courses and the dissertation pathway. And our international team of experts and researchers at Griffith University are here ready to supervise you in that choice. If you decide that you would prefer to focus on a coursework pathway or the standard pathway, this is where you have the opportunity now to choose from a broad selection of elective courses. And these courses, as you will see from this list, enable you to match your courses up and your pathway exactly to the focus and feature of where you want to grow your career. So, for example, you may want to become a lactation consultant. So you might decide to choose our Advanced Breastfeeding and Lactation course. Others of you are working with women and may wish to choose to do our Perinatal Mental Health course, which is exceedingly popular with our current students. We are very proud of this programme, and we want you too to be proud of your achievements. We want to enable you to go forward and transform healthcare in your environment. And we know that this programme has been designed to enable you to do exactly that. It's the first and only programme in the world designed specifically to move the maternity reform agenda forward and to enable you to fully implement the recommendations of the Lancet Series on midwifery. Thank you.